Hello friends, I'm Dr. Sagar Chandani here once again in front of you for another educational session on your dental care oral hygiene. Don't forget to like or subscribe to the channel because we have a lot of things coming up, and of course everything is going to be in continuation as to how can you have sparkling teeth. The topic for today is going to be what all do we require in our dental care armamentarium. So of course, when we say the dental care armamentarium, the first thought will be we require a toothbrush, we require a toothpaste. Right. Let's understand what kind of toothbrush we require and why. Number one, we require a toothbrush which will have soft bristles. Now there are different types of bristles which are available, which can be soft, medium or hard. So for an average person who has good dexterity and make sure you can brush properly, in those instances we require toothbrushes which are either soft or ultra soft, which means there is absolutely no pressure which is going to be coming in from the bristles onto the surfaces of the teeth. Then when do we require medium or hard? For those who have some issues, having some neuromuscular coordination problems, are not able to brush well, do not have adequate strength in their palm and hand, for those people we advise to go for something which is going to be making a compensation for the strength of your hand or your palm. Then we say go in for something which is medium or to go in for hard. Now, there's also something which is known as an electric toothbrush. So manual toothbrush versus electric toothbrush. If you can take efforts in learning the brushing technique, if you can find out time to actually do the brushing technique correctly, spend good 2 to 3 minutes to finish the entire area of the mouth, then manual toothbrush is good. However, in many instances we have seen that people prefer an electric toothbrush because the brushing technique movements are already incorporated inside the electric toothbrush mechanism. So for those people, electric toothbrush also works. Ultimately, the basic aim and objective still remains is that you need to brush properly. Now, brushing, if you are doing it correctly, will make sure that whatever plaque and deposits are present on the teeth will be completely removed. But is brushing enough to maintain? The answer is no. So brushing has to be supplemented with something known as using a mouthwash. Now mouthwash, again we have different brands, but more importantly we need a mouthwash which has fluoride. Same goes in for a toothpaste which should have fluoride. Basically it is this fluoride which is going to be taken by the enamel, which is the top layer of your tooth or teeth, which is going to be making it resistant and making it have all the protection it needs from the decaying substances. So toothpaste should have fluoride, mouthwashes should have fluoride. Now, when to use a mouthwash? Simple technique. If you are brushing early in the morning after you wake up, if you are brushing at the end of the day before you sleep, and you still have about 3 to 4 meals in a day, it's better to have your mouthwash used post lunch so that we are able to break the 12-hour, 14-hour cycle where food goes in, mouth becomes acidic, and the brushing is at 12-hour interval. So we are putting in something which is going to act as an adjunct to your oral care. How do we use a mouthwash? We are supposed to dilute the mouthwash with water if we want to use it on a daily basis. So the cap size of the mouthwash in a glass size of water should be the perfect dilution for usage of your mouthwash. So you need to brush twice a day with a fluoride containing toothpaste, a soft or an ultra soft bristle toothbrush, and usage of a mouthwash which needs to be done post lunch, and it needs to be diluted. So are we good? Not yet. There's something known as a dental floss. Now dental floss is a thread-like structure which has to be used between our two fingers and then placed in between the teeth so that wherever the brush is not able to reach, the floss reaches, cleans the area and prevents food particles which get stuck up. And we all know if the food particle is stuck up for a considerable amount of time, it is going to invite bad breath and cavities. So we don't want either of those. So make sure you're using your dental floss, which preferably should be waxed, W-A-X-E-D, waxed, so that it makes a squeaking noise every time it goes in between the teeth and the area becomes perfectly clean. When do we use a floss? The floss has to be used once a day. So just after your dinner and just before your brushing, use a floss which goes in between each of the teeth, cleans it completely. Then you use your toothbrush and have a fluoridated toothpaste. Then brush it properly. So the advantage that gives is whatever is stuck up in between the teeth comes on the surface of the teeth, and then when you brush, it completely clears out everything. So are we good? Not yet. We also know that if there is a coating or things which are stuck up onto the surface of the tongue, that also can cause bad breath. So to eliminate bad breath, we also need to clean our tongue. So either we can use a tongue scraper, or we can use the bristles of the toothbrush or the back surface of the toothbrush. Either of these, the goal still remains to make your tongue clean. So now your oral health maintenance makes sense. So what are the armamentarium requirements? A toothbrush, which needs to be soft or an ultra soft bristle. You need a toothpaste which is fluoride containing. You require a mouthwash which also has fluoride in it. And you also require a dental floss. Have we missed anything? The tongue scraper or your toothbrush which can be used for cleaning the tongue. If you do all of these, your daily home oral care is well sorted. If you remember our first episode which we had done on our YouTube channel, it spoke about when you need to see the dentist, which needs to be once every 6 months. So once every 6 months, the dentist is going to take care of your professional cleaning and maintenance. Couple that with your daily home care, and now you have good teeth, strong teeth, healthy teeth, and more importantly, sparkling teeth. Don't forget to like this video. Don't forget to subscribe to this channel, and do share it with all the people so that everyone benefits. Dr. Sagar Abhichandani signing off for today. See you on the other side. Take care.